ODM leader Raila Odinga has recovered from COVID-19. Odinga, who appears still on the recovery path, has disclosed his treatment regime that had him on supplemental oxygen for days before he tested negative for the virus 3 weeks since his hospital admission. Odinga is now calling on Kenyans to be disciplined in observing COVID-19 protocols, even as he prepares to get vaccinated in the days to come. Gituku spent the day covering Odinga alongside President Uhuru Kenyatta as they toured development projects.
For the first time in 3 weeks, the ODM leader was in public, ready for a long day crisscrossing 3 counties alongside President Uhuru Kenyatta, touring and commissioning various projects. Happy to be back in the limelight, acknowledging greetings from members of the public who had not seen or heard from him since he was taken ill. He kept his quiet, occasionally acknowledging briefings from government officials, impressed by what he saw. And when he spoke, he had a recollection.
Mungu ni mwema. Sasa kwa wiki 3 nimekuwa hali ya mahututi, lakini sasa nimetoka na nimefuraha kuona kazi muhimu ambayo inaendelea. Rais Uhuru Kenyatta ambaye amekuja akanitoa kwa kitanda akaniambia nitoke.
Odinga walked to hospital on Tuesday 9th of March. He had complained of joint pains and body fatigue. He underwent several tests, including COVID-19, and in a few days he was confirmed to have contracted the virus.
You hardly can tell how you contract this disease, because you really try to do your best. Like I've been keeping social distancing, I've been wearing masks, and I've also not been avoiding crowding. But it just comes, and you find yourself feverish and getting a little bit weak. And then when they do the test, then they find that you are positive.
And as Raila disappeared from circulation, his doctor Oluocholonya informed the nation that he was in good spirits and would address the public in not so long. Raila now revealing his ordeal during his admission.
They put me on a certain drug that they were administering intravenously for the first 5 days. And when they stopped that drug, then when I went back, actually I was in a regime of a mixture, more of herbal drugs that I was able to receive. And that's what I've been using. And secondly, I've been steaming a lot in the evenings.
At a time the country is grappling with hospital capacity crisis, especially for severe COVID-19, Odinga's case deteriorated and required to be on supplemental oxygen. Normally, oxygen levels should be 95% and above.
I was on oxygen for a while, but then eventually they weaned me out of the oxygen, because now my oxygen levels are 90 and above.
3 weeks later, Odinga says he has been certified negative.
Mara mbili mfululizo, madaktari wamekuja wakanipima na zote zikatoka ati COVID negative.
Na tuko na furaha tukiwa pamoja naye, tukijua ya kwamba sasa tunarudi kazini pamoja vile tulikuwa, ya kuunganisha wa Kenya.
With a few far between coughs and a hoarse voice, Odinga says he is committed to the process.
It takes a process, and one just have to be at it and has to be disciplined and follow the instructions of the doctors.
As he makes a case for the vaccination drive, currently targeting frontline workers and persons above the age of 58.
I am going to personally arrange to do a public vaccination so that people can see that I have confidence in the process.
And after day-long activities, the two leaders are firm on Kenyans to faithfully observe the COVID-19 containment protocols, terming it the sure way to reopening of the economy and alleviate the pain already being felt by different sectors. Gituku, Citizen TV at State House, Nairobi.